When we talk about neighbourhood teams, we're really talking about one simple idea that the best care happens when we organise around people and communities. There's a lot of strategy behind this, and the NHS's 10-year plan lays it out clearly. It's about prevention, integration, making care local, personal, and proactive. But for me, it always comes back to something simpler. It's about relationships. When you bring together GPs, nurses, mental health workers, pharmacists, social care, and voluntary services all working as one team in the same place for the same people, that's when care starts to feel like it actually belongs to the community again. Right now, many of those relationships are missing, not because people don't want to work together, but because the system isn't built to make it easy. Teams are overstretched. Services are siloed, staff are exhausted, and often we see duplication, confusion, and patients falling between the cracks. Neighbourhood teams are meant to change that, but it's not as simple as creating new structures. It's cultural, it's relational, it's about changing the way people see themselves from my service to our neighbourhood. And that shift doesn't happen overnight. Something we often see when working with neighbourhood teams is that on paper, the structure is in place, the roles are defined, the partners are listed. But in practice, people are still working in silos. This is not because they don't want to collaborate, but because there hasn't been the space, time, or support to really build those working relationships. Teams need to understand each other's roles, responsibilities, and pressures. It's about building trust, clarity, and a shared sense of purpose across the neighbourhood rather than adding complexity or launching new initiatives. It takes time, it takes listening, it takes leadership that's willing to be flexible, to share power, and to hold space for uncertainty. But we've seen it work. We've seen neighbourhood teams reduce duplication, improve access, and most importantly, lift morale. When professionals feel connected, trusted, and purposeful, they're better able to support the people they care for. We help teams build the confidence to lead across boundaries, not just within them. And we focus on relationships because that's the foundation of everything. We're not here to impose anything. We're here to support the people doing the hard work to make it just a bit easier and a lot more connected.